Good morning and welcome to the Campus Conversation. I'm Sharon Martin, Vice President of University Relations and Enrollment Management. As we wrap up the spring semester, it's time to begin preparing for the fall. I know we're all looking forward to a new normal, and a COVID planning team has been working on how to best prepare while keeping our health and safety a top priority. Earlier this week, we sent a communication that outlined the university's current plans for campus life this fall. We know it was a lot of information to process. Today, we're going to talk about those topics further, including vaccinations, in-person instruction, student life activities, and protocols for campus operations. We will also explain the vaccination verification system and why it is important for all to participate. To help lead our discussion today, we have 4 senior leaders with us who will present information and then respond to your questions. Joining me are Dr. Jeff Coben, Associate Vice President for Health Affairs and Dean of the School of Public Health, Mary Ann Reed, Provost and Vice President for Academic Affairs, Corey Ferris, Dean of Students, and Rob Alsop, Vice President for Strategic Initiatives. We will follow our typical campus conversation format today. We will share information, a presentation, and then we'll move to questions and answers. We are using the Zoom webinar platform for today's discussion. And before we begin the presentation, let's run through those features to help you experience today's conversation in the best way possible. To view closed captions or subtitles, click on the CC button in the bar at the bottom of your screen. If you have questions, use the Q&A function also found at the bottom of your screen. To further secure our conversation today, participants will only be able to see questions that are answered by one of our moderators. To ask a question, just click on the Q&A button and a separate screen will appear, and that is where you can type your question. Please note that many of your questions will be answered as our presenters review the material. Therefore, we will not be answering any questions until after the presentation. We'll answer as many questions as we can live, and our moderators will also answer your questions via typed response in the Q&A. If you have any issues with audio or video at any point during the conversation, be sure to check your personal Zoom settings. But if issues continue, you can email us at campusconversations@mail.wvu.edu. We will be monitoring this feed throughout the presentation and can help as needed. So we've taken care of all the housekeeping items, and now it's time to start the conversation. And with that, I'll turn it over to Dr. Coben to begin.
Thank you, Sharon, and good morning, everyone. As you can see, this slide speaks to the future, and we're going to spend most of our time today talking about what we think the future will look like. But I wanted to take just a minute to look back and to congratulate and thank the entire WVU community for what we've been able to accomplish by working together this past semester and this past year. One of the themes that I think you're going to hear today is that our success and our ability to reopen things safely is really in your hands. We have only been able to succeed this past year because you have taken the steps to help keep us safe, keep us together, and to follow our health and safety protocols and take care of one another. And if we continue to work together, we're confident that we can have an even more successful year ahead. So with that, we plan to begin the fall semester on August 18th. Our number one priority is to ensure that we can get all of our students back into the classroom in a face-to-face instruction modality so that they can begin to experience that college experience and those learning opportunities. We know, however, that the pandemic is not over, and there are concerns that we will still need to pay close attention to. There are transmissible variants, and there are regions of this country and regions throughout the world that are experiencing significant increases in COVID-19. Because this is a pandemic, what happens elsewhere can affect us, and we will need to continue to remain diligent and carefully monitor these public health occurrences as we move forward. Our plans that we'll lay out today are preliminary, and they may need to be adjusted as we move forward and get closer to the fall semester. Our finalized plans will be communicated throughout the summer, and we will have continued opportunities for dialogue through campus conversations as well. So please monitor eNews and our student website for further updates. Next slide. I'd like to spend a little bit of time talking about the COVID-19 vaccine. We firmly believe that our best opportunity for emerging from the pandemic is for everyone to get vaccinated. Our goal is to reach 80% vaccination rate for the WVU community, including our students, faculty, and staff. We believe that if we can reach some targeted milestones that we'll talk a little bit about later, that we will be able to relax certain restrictions and increasingly resume activities across our campus. Vaccine clinics are available on our WVU Morgantown campus, as well as in settings throughout the communities in West Virginia and throughout the nation. Although our Beckley and Kaiser campuses will no longer operate vaccine clinics, students, faculty, and staff at these campuses who are not yet vaccinated can certainly receive those vaccinations throughout the community, and we encourage you to seek them out. Next slide. One of the things that we know is at the current time, young people are being more heavily impacted by COVID-19 than other members of our population. And that is in large measure because our vaccination rates amongst younger people are still not what we'd like them to be. The COVID variants are significantly spreading across that population and can make them quite ill. So it's important that we really take this seriously. At the current time, the university is not requiring vaccination, but we are strongly recommending it. Be advised that that recommendation may change as the FDA looks at the approval status of vaccines which are currently under emergency use authorization. As those vaccines move out of emergency use authorization and into approval stage, we will also reassess and reconsider the requirement around vaccines. But beyond that, I also just want to take a minute and really add some additional data and information to help explain to you why we think this is so crucial and so important to get vaccinated. As of 2 weeks ago, April 26th, a total of 95 million people in the United States had been fully vaccinated against COVID-19. Of those 95 million people, only 9,245 cases of COVID have been reported following the vaccine. What that means is that 99% of people, actually 99.9% of people who've been vaccinated have been protected and have had no evidence of COVID-19 following the vaccination. Nothing is 100%, but 99.9% is really amazing. And it's an amazing opportunity for all of us to help end this pandemic. Next slide. As we look forward to the fall, we also plan to continue our health and safety protocols and to pay close attention to the guidance that's provided through the Centers for Disease Control, the state of West Virginia, and our local health departments. We anticipate that our current policies around mask wearing, contact tracing, quarantining travel, and other similar policies will remain in effect as we move towards the start of the semester. But we will continually monitor that guidance as well as our disease transmission rates to make final determinations on potential modifications to our protocols and guidelines as we get closer to the fall semester. So with that, I will now turn it over to Provost Reed.
Thank you very much, Jeff. and good morning, everyone. So I'm pleased to report that our fall semester will begin as scheduled on Wednesday, August 18th. Most of our classrooms and educational opportunities will operate in person and at full capacity, although we will continue to have some courses being offered online as we do in a typical semester. And there may be more hybrid offerings because faculty and students have become more comfortable with that format. So to ensure the safety of our students, faculty, and staff, masks must be worn in the classroom and plexiglass will be available for faculty use. Instructors will continue to take attendance and they will use seating charts to aid in contact tracing should that become necessary. The Office of Accessibility Services will continue to work with students and faculty who have ADA needs. I will say, though, that if these needs are COVID related, this will become more limited because of the widespread availability of the vaccines and our knowledge that the vaccines are highly effective. As with the spring semester, the university will implement a traditional grading scale. We know that it is in the best long-term interests of our students to have a transcript with very limited number of pass fails on that transcript. And also employers look at those, some of the employers look at those transcripts as well. The Office of Global Affairs will continue to review and evaluate any proposed study abroad trips on a case-by-case basis, allowing for appropriate travel preparation. And I will tell you that this is a moving target. For example, the State Department, really in coordination with the CDC, has now issued travel advisories, actually no travel advisories for more than 100 countries, including many countries in Europe where we typically send our students for study abroad. So we will be following that closely. And now I'm going to turn it over to Corey.
Thank you, Mary Ann. And I do want to echo what Dr. Coben said. I'm truly grateful to our students for all they've done to get us to this point. It certainly has been a difficult year. I'm glad we are in the process of finishing up the year in a much different place than where we started. And so again, that's to you students to give you credit, and to the faculty and staff who supported our students. I greatly appreciate it. Last week, let me move over to the slide. Last week, we conducted a survey and we got some great information from our students. More than 2,000 students responded. And I'm happy that 85% of our students received or plan to receive the COVID vaccine. We achieved that once we open up in the fall. That's going to get us to the place that we need to do an awful lot of things that I'll talk a little bit about later on. 71% of our students who completed the survey feel extremely or very comfortable with WVU's decision to hold in-person classes this fall. And 70% of our students feel comfortable or very comfortable, extremely comfortable knowing that masks will be required when we return to campus in the fall. Again, students, thank you. That's great information, and that's going to get us to the point where we need to be. Next slide. So let's talk about next fall a little bit and what we're planning at this point. So the plan is to restart the PRT at the beginning of August. Now we're going to have some limits on the number of people that can use the PRT, and that's going to be based on the percentage of our campus vaccination rate. You saw that in the information that was released a couple of days ago. And again, masks will be required while waiting on the platform and riding on the PRT. Buses are going to operate over the summer. And of course, Mountain Line buses is what I'm referring to, as well as Mountain Line obviously will be continuing to operate in the fall. The university is going to operate a limited number of buses during the summer and similarly during the fall semester. Again, with the PRT and buses, we'll be able to move our students around campus so they'll be able to get to their classes efficiently. Let's talk about the rec center. We know lots of you are excited about the rec center. We will be doing a slow reopening of the rec center for those that will be students, registered students over the summer. In a few weeks, we will be starting a slow reopening of that with some limited access. Again, until we know what our vaccination rate is, we have to be very careful. And that use, as we move into the fall semester, is going to be based on a number of things that we'll be working with our health committee on, but vaccination and infection rates are the key indicators that we're going to be watching. So I will talk about that rec center. So not only will we be opening the rec center for some of those indoor activities, machines and weights, expanded use of the swimming pool, but the other thing is we'll continue to offer some of those online activities as well as outdoor activities, assuming weather's cooperative well into the fall semester. But hopefully we'll continue to raise our vaccination rate and get our students so we can open it up much more fully. Intramural sports, we hope to resume those also, but again, we'll have more information about that as we get closer to fall semester. We understand our vaccination and infection rates on campus. Club sports will be able to resume their practice and conditioning sessions and competitions and travel with certain restrictions. Towards the end of the spring semester, we allowed that to resume, and those students were regularly tested. So we'll continue to watch and provide guidance for our club sport teams. WVU Up All Night, we know that's always a popular thing. We resumed that again at fall semester and again spring semester, and we will allow those in-person programs at the movie theater, crafting, e-gaming, certainly food. We'll allow those to start for fall semester. Again, the number of people we'll be able to allow into the mountain lair for those activities will be limited depending on the vaccination and infection rate. Student organizations, again, you'll be able to start having some of those meetings in person using the mountain lair or classrooms or other venues around campus. Again, we will do that when we're safely able to do that, and masking obviously will still be required when you're on campus in those meetings. And Welcome Week, let's talk a little bit about Welcome Week. We will have a Welcome Week experience similar that we had a Welcome Week experience for fall semester of 2020. We'll have a different one for fall of 21, and more information to come as we roll over the summer and approach fall semester. But we're looking forward to some exciting activities, more information to come. For those that are living on campus in the residence halls, whether you're a returning student or whether you're a new student watching, we will resume move-in on August 9th through Saturday, August 14th, in which case at that point we'll start some of those Welcome Week activities. But students will be registering for a 90-minute time window to move in, and you'll be able to have 2 helpers with you during that move-in period. Everyone during that move-in will be expected to wear a mask, face covering, and follow the safety and health protocols that we'll have and we'll let you know about as we get closer to move-in. And also dining services. We know there were some limited options this year. We hope to fully reopen all of our dining operations across campus once we resume a fall semester. We will hopefully return to self-serve buffet options. And again, we'll be able to do that safely, and those enhanced cleaning procedures will continue. And if I can put a little plug in for dining services, those of you that might be looking for a job next academic year, I know they are looking to hire lots of our student workers. So be sure to reach out to dining services if you're looking for a fall job. And let's talk a little bit about that COVID education model. All of us, faculty, staff, and students, took an education module last summer. We plan to update that education module prior to the start of school. And again, all of us will be required to review it and work through that module. And again, details of that module when it's available and the window which you have to complete it will be announced as we move towards the summer. And with that, I will turn it over to my colleague, Rob.
Good morning, everyone. So I want to spend just a little bit talking about our employees and our long-term work arrangements for the campus. So just for everybody's benefit and knowledge, for those who've needed to be on campus from an employee perspective, we've had individuals there. For those who have been back to campus to work, but a significant portion of our employee population have continued to work from home. As we ramp up towards the fall semester and hopefully all of our students coming back for face-to-face format, we will be bringing back a lot of our employees back into the workplace. However, we've learned a lot through this pandemic about how flexibility and the ability to work from home has not negatively impacted productivity and in some instances has enhanced it. And so we have started a process of looking about which employees will need to have a physical presence on campus and which will continue to work from home or on a hybrid basis. And so supervisors will be asked to confirm or update the long-term work arrangements for their employees, for their direct reports in the Applaud HR system before Monday, May 31st. These arrangements can include a full remote work schedule where employees will work remotely at all times. Now, these employees may occasionally be on site for a meeting or to attend a university function, but they typically will not maintain a designated physical office or cubicle space on campus. There will be those that will have a hybrid work schedule where employees will be at the work site for a specified number of days each week on a regular schedule. The scheduled days the employee works on site may vary from week to week. And then finally, our on-site work schedule. Employees that will need to be on campus and work on site at a WVU campus or a location in a dedicated workspace or on a regular schedule. Now, there's a lot to work through here, and I'm going to hit just some of the highlights, but we'll be updating our telecommuting agreements to roll out early this summer. Employees will need to work with their supervisor to establish an effective date for the agreement. Work status information will be used as the university reconfigures workspaces and introduces programs, policies, and services that are specific to remote or hybrid employees. Now, as I mentioned, there's a lot to go through here, a lot of details that we're still working through going forward. So some of these efforts include updating our policies on reimbursable expenses for remote and hybrid employees, deploying special parking programs for hybrid employees, exploring opportunities for discounts from local internet and cell phone service providers and office suppliers for those who will be working remotely, and examining the Safe Streets and Safe Community Service fee for employees who work in a totally remote capacity and reside outside the city of Morgantown. Now note, when we come back to campus, as we ramp up towards the fall, we are going to require that all meetings continue to include an option for remote participation. Now that could be Zoom, Microsoft Teams, or a conference line. We are going to have that option for our employees who are either out of the office in a hybrid or remote experience. As Marianne indicated, there will be some workplace accommodations, and we are reviewing the need for employee ADA accommodations and non-ADA accommodations specific to COVID-19 for the 21-22 academic year. Employees who want an ADA accommodation or a non-ADA modification for the fall semester need to submit their application and updated medical documentation by June 1. Employees who previously had an accommodation or modification need to be aware that future adjustments may differ from past or current accommodations given what we're planning for the fall and the availability of vaccines. Visit go.wvu.edu/coronavirus-modifications for more information, or you can contact us at coronavirusmodifications@mail.wvu.edu with any questions. Finally, I want to talk about the COVID-19 verification system. As Dr. Kobit indicated, for those who've been vaccinated, only 0.01% of those individuals across the country have tested positive. As we work through the semester, this past semester, what we really focused on as an institution is how do we keep the rates of infection low, or if the rates of infection increased, we pivoted to take additional actions. We moved more courses online at the beginning of the semester, and then we took a 2-week pause, all dictated by the rates of infection on our campus. And what we know with these very safe and very effective vaccines is that the more people who are vaccinated, the better the chance we have to keep infection rates low, and the better we can know how to design our campus for the fall. We're planning on bringing everybody back, but our ability to open up and relax some of the additional protocols that we've had to live through are going to be dependent upon that low rate of infection, which will be determined in large part by how many of us get vaccinated. To help guide that decision-making, we have launched a COVID-19 vaccine verification system. All students and faculty and staff who've been fully vaccinated for COVID-19 need to verify their vaccination with the university by August 1st. Those who do not complete the verification process will be considered unvaccinated this fall. You can go to myhousing.wvu.edu to complete the form via the Star Res WVU's housing portal. Exemptions will apply to verified immunized individuals. Those who have been vaccinated will not be required to undergo re-entry testing this fall, undergo surveillance testing during the semester, quarantine if they're exposed, or quarantine following travel. And one thing that I do want to stress, we are counting those who have been vaccinated as those who have been fully vaccinated. And so we need to know information on that we can verify on when you received your first dose, if it's a Pfizer or Moderna, when you received your second dose, when you received those doses, and where going forward. So when you go into the system, please answer every question and certify to give us that the information is true and accurate, and that we can confirm your information through the VAM system. Incomplete information is not sufficient to consider someone fully vaccinated for purposes of making decisions in the fall. Again, our decisions for this fall will be contingent on community immunity. As Dr. Coben said, our ability to navigate this fall is going to be dependent upon your actions. The more students and employees that are vaccinated, the more likely our infection rates will decrease. And we can continue to reducing the COVID-19 protocols in place beginning September 1. And so we feel really comfortable about the in-classroom experience given what we had this past fall. But our ability to open up some of the additional activities that we know you guys all really like is going to be dependent upon keeping those infection rates low, or said another way, by the number of vaccinations we have on campus, which will, based on all of the data we have, reduce those rates of infection. So we've set up some clear paths towards reducing some of these COVID-19 protocols once we reach certain thresholds together as a community. So once 50% of the WVU population, faculty, staff, and students has been verified to us as fully vaccinated, we're going to take these steps. We're going to open up the rec center to 50% capacity with reservations. Up All Night will open up to 50% capacity. Concert shows and plays will open at 50% capacity, and the PRT will run with 6 passengers. Once 60% of the WVU population has been verified as fully vaccinated, we'll open up more. So the rec center will go to 75%. Up All Night will go to 75%. Concert shows and plays will open at 50%. The PRT will move from 6 to 8 passengers. Non-contact intramural sports will resume. Outdoor sport activities will resume. Fall Family Weekend will be conducted in person. Student organizations can host community and social events. Residence hall visitation will be open to all WVU students. Groups of 10 or fewer can congregate outdoors without masks, and fraternities and sororities may host in-person recruitment. Again, the more we know that are vaccinated, the more activities we feel comfortable moving towards a pre-pandemic activities for the campus. And then we have our final step. Again, our goal is to get 80% immunity. Most of our health folks have indicated that once we reach 70 to 85% of our population having immunity, we will attain that community immunity. So we've said once 75% of the WVU population has been verified as fully vaccinated, we're going to take these steps. The rec center will be completely open. Up All Night will be at full capacity. Concert shows and plays will be at full capacity. We'll run the PRT with up to 12 people. Contact intramural sports will resume, as will all sport activities. Residence hall fitness centers will open. Plexiglass dividers will largely be removed from the dining halls. Homecoming activities will be in person, and Welcome Week activities will be held in larger groups. And we know we've heard from a lot of folks that there's a big desire for a lot of Welcome Week activities. The best way to assure that is to get your vaccine. To that point, WVU will host a vaccine clinic on Friday, May the 7th from 1 to 4 o'clock at the Student Rec Center in the upper gym. Anyone interested in receiving a Johnson & Johnson, Pfizer, or Moderna vaccine can walk in on a first come, first served basis. Both first and second doses will be offered for Pfizer and Moderna. The university will continue to offer COVID-19 vaccines on campus throughout the summer. Finally, we know that there are a lot of folks who are hesitant to get the vaccine. From our perspective, we think they're safe and effective, and we strongly recommend that you do so. We also understand there's a lot of information, and particularly with social media, a lot of anecdotes that may either get misquoted or blown out of proportion moving forward, and it's hard to sort through the information sometimes. All the data we have suggests that they're safe and effective. If you are hesitant, if you do have concerns, we urge you to either come to one of our clinics or speak to a healthcare provider to learn more. We will have healthcare providers at our clinics, not only to get the shot, but to answer your questions. So that if you're hesitant, we can help you understand the benefits of taking this vaccine and what it can mean for you and for our campus. And with that, Sharon, I will turn it back over to you.
All right, great. Thank you, Rob. So we're now going to move to the Q&A portion of today's discussion. A reminder to use the Q&A function at the bottom of your screen if you have a question for our senior leaders. If your question does not pertain to today's topic, we will hold it for a future conversation. And we'll also be identifying trending topics and framing questions to summarize that interest. So that means all live questions may not be asked verbatim, but your topic will be addressed. So please listen carefully to identify a question that may address your concerns. And we may not be able to address every question live today, but our moderators will continue to answer questions via typed response in the Q&A tool. So as we get our live questions rolling, I'm going to turn to a few that were submitted to us earlier by email. And Dr. Coben, I'm going to start with you. You addressed this in your presentation, but there's still lots of questions about why we are not requiring the vaccine and instead just encouraging people to get it. So can you talk a little bit more about why we're choosing not to require at this time?
Yeah, sure. I'm happy to start, and others can join in as well. So we understand that there are many who believe that we should require or mandate vaccines. We also have heard through our surveys and from input from a variety of other stakeholders that there are many who believe we should not have such a mandate. And we know that as of right now, the policies around this across the country are quite varied. Some institutions at this point, the minority of institutions of higher education are moving towards a requirement, but the majority have not yet made that a requirement. At the current time, we're moving forward with a very strong recommendation that people go ahead and get vaccinated. As I mentioned in my presentation, we will continue to assess that as more and more information comes available, and as the status of the vaccines perhaps change from an emergency use status to an actual approved status through the FDA. So stay tuned. And also, we believe and look forward to seeing the vaccine uptake amongst our students, amongst our employees, and hopefully we'll have sufficient uptake voluntarily that such a requirement would not even be necessary.
All right, great. Thank you, Dr. Coben. Rob, this next question is for you, and it ties into the vaccine verification process you talked about. They're asking, can incoming freshmen submit their vaccine information in the portal?
Once a student has made their academic deposit, they can upload their vaccine certification. They can log in and certify that and provide that vaccine information going forward. So once you've done that, you certainly can.
All right, great. Thank you, Rob. Corey, I know that you talked about this in your comments a little bit about Welcome Week, but lots of questions about what will Welcome Week look like? Will we have Welcome Week events? So can you talk a little bit more about that and how we'll address that as we approach fall?
Sure, thanks, Sharon. Well, let me start out by saying, knowing that we were still young and understanding the spread of COVID and there weren't vaccines available, we had a very different welcome week to start the academic year in fall of 2020. Fast forward now, we know and understand COVID better. There are vaccines, and so we're going to have a welcome week for fall of 21. It's a little early, I think, to understand what welcome week will look like for fall of 21. I'm pretty certain it's not going to look 100% like it was in fall of 2019. Pre-pandemic. We'll still be in the pandemic, but we're planning on some fun activities that we can do safely. But I do want everyone to remember that we're keeping in mind our focus is to start the academic year strong, and our priority is to keep our students in the classroom following the established academic calendar. So stay tuned and watch for announcements over the summer, and we'll have more information about Welcome Week coming up.
All right, great. Thank you, Corey. And Marianne, there was a question about social distancing in the classrooms and in personal offices and how that's going to be enforced this fall. So in particular, we have someone asking if they are trying to operate student academic services such as advising or tutoring, how much of that could be done on a one-on-one setting and what kind of physical distancing should we be requiring?
Okay, thank you, Sharon. So let me just say again about our classrooms that we demonstrated that our classrooms were very safe this fall with wearing masks and some social distancing. We had only one known incident of a COVID transmission, and that was a really isolated case under very special circumstances. So our health experts believe that with masks and a good number of people vaccinated, that our classrooms will be even safer, and that we won't need to social distance in the classrooms. But whenever possible in these one-on-one interactions, when people are face-to-face, we ask that you use good judgment, wear masks, and distance as much as possible.
All right, great. Thank you, Marianne. We'll go now to some of the questions that are being asked by our viewers. And the first question, Dr. Coben, I'm going to pitch it to you. They're asking, are low incidence rates included in the parameters to open back up along with vaccine rates? So are we considering both incident plus vaccination rates as we look at how we'll open campus?
Right. So we certainly will. We have and will continue to closely monitor infection rates within the WVU community, within our surrounding communities, and across the state of West Virginia. And right now, all those things are moving in a very positive direction. Should things shift, we will pivot as we have pivoted in the past. But I will say that we strongly believe that if we continue on a pathway of increasing vaccinations, that those rates will continue to decrease. So one really will feed right into the other in terms of our reopening opportunities.
Okay, great. I'm going to stay with you for this next question. And they're asking if certain communities, such as graduate students in a specific program at Health Sciences, have an 80% vaccination rate, could those classes return to normal rather than relying on the entire community and campuses not related to us?
Well, the classes will actually be returning to normal for all of the university. As I mentioned, as we've mentioned at the beginning, our primary goal is to get everyone back into face-to-face instruction at full capacity in the fall. So the vaccination rates really won't influence that. What the vaccination rates will influence is our ability to open up other activities across campus that all of us would like to participate in. So we believe that with continued mandatory mask wearing in the classroom and with increasing vaccination of our population, that we'll be in full capacity in those classroom settings throughout campus.
All right, great. Thank you. Marianne, this next question is for you, and it ties into ADA accommodations. They're asking, how are faculty, staff, parents how are they supposed to be in a position to request non-ADA accommodations when, as of June 1, we will likely still have no idea what will be happening for public schools this fall? So how can parents who may not know what their fall plans will be looking like yet make those accommodation requests for ADA needs?
So I think in terms of employees, right, we have, there is something called modification of duties. It's not ADA. And that is, that those are again typically for health reasons, not for childcare issues. I'm not entirely sure I understand the question. I'm trying to answer it the best that I can. Students who have I'm not sure what a non-ADA accommodation is for students. So I am not sure I'm able to answer that fully.
So let me,
That's okay.
let me
Robert,
jump in, Sharon, because I think I covered that a little bit.
Okay, thanks.
So, if an issue for an ADA accommodation arises after June 1, you can certainly file after that. But if you know that you have an immunosuppression issue, for example, that's going to impact the fall, we're asking you to file for that prior to June 1, so we can do our fall planning to make sure that we take care of classes, that departments have opportunity to do so moving forward in that instance. The other thing I will say is it is true that I don't know that they've finalized the plans, but everything we have seen and heard would indicate that just like we're going to be back in the classroom in the fall, that K through 12 will be back in the classroom for the fall. And so we are planning on the assumption that our students will be, that there will be more face-to-face activities, not only at the higher education level, but at the K through 12 level as well. So let me be clear, if you have an ADA accommodation need that arises after June 1, we will consider it. But if you know now, we'd like to know before June 1 so that we can do the planning we need to do.
Great. Thank you, Rob, for jumping in there. I appreciate that.
Thanks, Rob.
Let's see, our next question, we talked a little bit already about social distancing in the classroom, but they're also asking what kind of physical distancing will be required elsewhere. So Dr. Coben, can you talk a little bit about how we might want to approach physical distancing outside of the classroom?
Sure. Let me try to provide a couple of examples here and maybe some background. Over the course of this past year, we've really had 3 tools in our toolkit to try to reduce the spread of COVID-19. The first has been to maintain good hygiene, practice good hygiene. The second has been to maintain social distancing. And the third has been strong mask wearing. And we know that of the 3 of those, that strong mask wearing is actually probably the single most important preventive measure that we can all take. As we're moving forward now, we have a 4th tool in our toolkit, and that 4th tool actually is the greatest tool of all, which is the vaccine and the success of the vaccine in reducing not just COVID amongst individuals who get the vaccine, but now increasing evidence that the vaccine is actually effective at reducing asymptomatic spread of COVID as well. So as we add that tool, we believe that some social distancing can be relaxed. You've seen that occur in recommendations from the CDC, which has now gone from 6 feet to 3 feet in classroom settings among children and in other settings as well. So I think the bottom line message is we're going to continue to maintain good practice good hygiene, continue a strong mask wearing ethic that we've had here at the university, and really boost our immunization success rates. With that, we think that less social distancing will be required, but I still think that it is prudent wherever possible to physically distance when you can and when that setting provides the opportunity.
And a quick follow-up, Dr. Coben, they're also asking if they've been vaccinated, do they still need to wear a mask, especially when they're outdoors?
Right. So as I mentioned, during my portion of the presentation, we are going to continue to evaluate our current guidelines. And guidelines around mask wearing are under assessment and evaluation by public health agencies across the country. And we're continuing to follow that pretty closely. We anticipate that as we move into the fall, we will still have a mandatory requirement for mask wearing in all indoor settings. In outdoor settings, we anticipate also having some sort of mask requirement. Exactly what that will be is still to be determined. I think that, for practical reasons, for practical purposes, whenever you're in close proximity with someone else, you ought to have a mask on indoor or outdoors. While the current CDC guidance has relaxed mask wearing for individuals in outdoor settings, they still recommend that masks be worn when individuals are in crowded outdoor settings or in other venues. And certainly when you think about settings across campus, that could be, there could be opportunities for closer contacts where we would recommend masks. So more to come. We haven't reached a definitive policy on what that'll be in the fall, with the exception of planned strong indoor requirement.
All right, great. Thank you very much. Corey, I'm going to pivot over to you a little bit and talk a little bit about PRTs. So they're asking, how will the PRT limits be enforced? Will there be people stationed at each platform during all hours of operation?
Thanks, Sharon. So here's one thing we know. When we start fall semester, more than half of our students will have never experienced riding the PRT, from this year's freshman class to next year's fall freshman class to our new graduate and professional school students have just not had that experience. So we know certainly in the very beginning, we're going to have lots of staff down on the PRT platform assisting and guiding and showing people how to ride the PRT. So yes, we'll have some folks nearby, as the PRT gets operating and as we manage that, because we certainly want to make sure everyone understands how to ride it safely, how to use the system safely and efficiently. But also, again, we've got limits on how we can use the PRT, so we'll have folks available.
All right, great. I'm going to stay with you, Corey, on a question about Welcome Week. They're also asking, will graduate students be welcome to participate in activities during that week, or is it just a focus on undergrads?
It's a great question. So Welcome Week every year generally has a mix of programs, some that are focused on freshmen, first-year students, and others are transfer students or commuter students. But we also have plenty of activities, and we'll have plenty of those activities that all students will be able to participate in, because we want to welcome everyone back to campus and have a great start to the fall semester and make sure it's off to a good start.
All right, great. Thank you, Corey. Rob, I know you've had a few conversations with athletics, and one of our questions is, what about football and basketball game days? What will that look like this fall?
So we're planning and hoping, take football first, since it'll come up first. We are planning and hoping for a lot more activities and a lot more people in our stadiums, in our football stadium and in our Coliseum and other areas. For the moment, athletics has been offering season ticket sales and moving along in that process going forward. As we move, and it's our goal that if rates that have declined, if they continue to decline towards the fall, that we'll have a great game day experience for the fall. It'll be a little bit longer in the summer before we can say for sure for finalizing those plans. But it's certainly our goal to have a lot of fans in our stadium and Coliseum and other venues this fall. Again, for us and for our community, the more students, the more faculty, the more staff who've been vaccinated, and we keep those rates of infection low, the more comfortable we'll feel together as a leadership team that we can have more people at those events without risking a significant spread of COVID-19. And so it really is dependent some on our activities as a community and where those infection rates as they move towards the fall. But we're hopeful for lots of folks having the opportunity to get the in-game day in-person experience.
All right, thanks, Rob. I'm going to stay with you for a couple more questions, and they tie back into that vaccine verification process. The first is asking, I'm a faculty member who was vaccinated through a WVU clinic. Do I need to complete the verification process?
Yes, even if you have been vaccinated at a WVU at the rec center, we need you to complete the verification process.
Okay. And then a couple questions about the threshold. So they're asking, are the vaccination thresholds calculated for each campus separately?
So what we have indicated is that students have to hit the 50% threshold, and then faculty and staff have to hit the 50% threshold each. So on that one, if faculty and staff are at 52 and students are at 48, then we don't move up to that particular threshold. And I'll need to confirm, I think we are doing it by campus in terms of Beckley, Kaiser, and Morgantown. But I will confirm that and we'll get that answer back out. But I believe they're each separately. And then again, students and then employees each have to reach the threshold independently.
All right, perfect. Thank you. Dr. Coben, this next question is for you. And they're asking, again, what is the rationale for requiring vaccination for individuals that have had previous COVID-19 infection and possess circulating antibodies?
Well, let me start by saying we're not requiring. We are strongly recommending at this time. And that strong recommendation also goes for individuals who have had previous COVID-19 infections. That is the guidance from public health experts and for health and infectious disease experts around the nation. And that is because the antibodies that are produced through COVID-19 infection only are felt to last for a limited period of time, that those antibodies last for a much longer period of time through vaccination, and also because the vaccinations have been shown to be more effective at controlling the spread of new variants as opposed to reinfections for people who have had actual COVID-19 have become increasingly reinfected with the new variants. So there are several reasons why it's recommended that even individuals who've had COVID-19 go ahead and get vaccinated.
All right, great. Thank you. Corey, this next question is for you and has to do with our residence halls. They're asking, what does visitation look like in the residence halls next year for students and for non-students? Will there continue to be a limit to the number of people that can be in a residence hall room at one time?
It's a great question. Well, so that is tied again to our vaccination rate. Right now, our plan is once we hit that 60% vaccination rate to allow WVU students to visit other WVU students in the residence halls. And so we'll continue to monitor that. But that's the plan, to allow that visitation to resume once we start fall semester.
All right, great. Thank you, Corey. Rob, I'm going to come back to you. A couple of questions about vaccinations as well as testing. And the first question is WVU going to provide shots for non-WVU residents?
So if you are an employee or a student of WVU, we will provide a vaccine to you regardless of your state of residency. So as long as you're a student or an employee and you want a shot, we'll provide one.
All right, great. And the next question they have is, will WVU continue to offer on-campus COVID testing throughout the summer?
Yes, we've partnered with the Mon County Health Department, and on 2 days a week, I believe it's Monday and Friday, for a few hours, we are going to offer testing at our rec center. So there will be opportunities for that. And of course, if you're not feeling well and you think you need a test because you may have COVID, you should contact your personal care physician, or you can contact student health.
All right, great. Thank you, Rob. Dr. Coben, I'm not sure we have the answer to this, but I will make sure we ask the question. And it's possible that we've seen some states begin to move that if they reach a certain vaccination rate, that the mask requirement will be removed. And so the viewer is asking, at what point will the requirement to wear a mask be removed? And we might address it just on a campus perspective.
Yeah, I think that's difficult to predict at this point in time. I certainly know that that's a goal of many people, is to remove that requirement. As Rob alluded to in his presentation, most public health experts believe that if we can get to between 70 and 85% of our community vaccinated, that we will have attained immunity from COVID spread across our community. And I think that those would be the rates that we'd be looking at in terms of potentially relaxing the mask wearing requirements.
Great. And I'm going to stay with you for this next question too. And they're asking, what would you recommend to say to a student that refuses to get vaccinated? What steps would you recommend that they maintain or do to maintain their right to make their own informed decision?
Right. So again, we have not imposed a requirement. So certainly that individual has the right to make their own decision. I would recommend that they become as informed as possible, to seek additional input from their healthcare provider, and to learn as much as they possibly can about the effectiveness and the safety of COVID-19 vaccines, either through credible sources such as the CDC and the FDA, or by speaking with one of our healthcare professionals who are available through our student health services. If after all of that, an individual still decides not to undergo vaccination, then I would strongly recommend that they wear masks consistently, perhaps double mask when they're in public settings or in closer settings, and maintain all the same precautions that we've recommended over the past year.
All right, great. Thank you. Good advice. Corey, this next question is for you, and they're asking, will Caruth move to more in-person therapy this fall?
Yeah, thanks, Sharon. Answering that question, the simple answer, yes. We offered some of that during this current year for those that were in crisis, but we plan to offer more of those and get much more in person. But I will say we know that some students like the convenience of telecounseling, and so we'll probably have a mix of that, but we certainly will have our counselors back in the office for that face-to-face counseling, absolutely.
All right, great. Thank you, Corey. Rob, this question is for you and ties into remote work. And they're asking, if my supervisor approves or confirms my remote work assignment, can I assume that I will have a remote work assignment for the upcoming year? When will I receive verification?
So yes, it will be for the upcoming year. I mean, we are moving. If you move to remote work, it is designed to be a long-term decision, and we will be making changes to our office space on campus due to that. So yes, if there is a determination of remote work, it will be long-standing, and you will know the answer sometime this summer. We're hopeful to have all decisions made. I think supervisors have to provide their decision by May 31st, and we want by August 1st everybody to know whether they'll be coming back or to be back or not as we move forward. So it'll be this summer.
All right, great. Thank you, Rob. Dr. Coben, another question regarding vaccines. This viewer writes, I'm a Chinese international student and I've been vaccinated in China using China's vaccine. If I come to campus, will I need to be revaccinated, or can I exempt the vaccine in the States?
Yeah, thank you. That's a great question. So this is another area that we are continuing to closely monitor as it relates to the current public health guidance. As of right now, the CDC recommends that the 3 vaccines that have been approved by for emergency use authorization by the FDA are the vaccines that have been shown to be safe and effective. That includes the Pfizer vaccine, the Moderna vaccine, and the Janssen J&J vaccine. The CDC also recognizes that the World Health Organization has approved the use of the AstraZeneca vaccine, and the CDC does not recommend repeat vaccinations for individuals who've received the AstraZeneca vaccine. However, all other vaccines that have not yet received FDA or WHO approval for emergency use would not be considered as demonstrating safety and effectiveness. So for an individual who might have received some other vaccine, unfortunately, they would be asked to undergo immunization with one of the approved vaccines that I mentioned.
All right, great. Thank you very much. And Dr. Coben, I'll stick with you. We have a viewer who says, I may have missed this, but what percentage of the WVU community is currently considered fully vaccinated? So what is that percentage again for us to be considered fully vaccinated on campus?
I don't think you missed it because I don't think we know yet. And that is the reason why we're asking everyone to complete the vaccine verification form as quickly as possible. We know a large number of our students and a large number of our employees have been vaccinated, but we also know that there are others who've been vaccinated outside of the WVU system or even outside of West Virginia that we don't quite have that information on yet. So stay tuned for more.
All right, great.
And I'll
Thank-
also mention, and Sharon, I'm sure you'll update, but we will have a ticker on our website that will demonstrate to everyone what our findings are from the vaccine verification, so we can continually track that as we move forward.
Yep, that's correct. That'll be on the Return to Campus website, and it will be updated every Tuesday. So folks can check in every Tuesday to see where we currently stand. All right, let's go to another question about vaccinations, vaccination clinics. So Rob, I'll pitch this one to you. And they're asking, will we consider offering more clinics to increase the vaccination rate for students as we get closer to the fall for the divisional campuses in Beckley and Kaiser?
So I think generally speaking, anytime we see a demand for vaccinations, we will work to host a clinic to make sure those are vaccinated. What we do know is that supply has now outstripped demand for vaccinations. And so if you're an employee or a student, and at some point in time, you desire a vaccine, there are opportunities in your local community to get vaccinated, including in Mon County to Mon County Health Clinic, as well as in different areas across the state. Yes, we will be providing additional opportunities for our students and university communities as demand dictates and as we move closer towards the fall.
All right, great. I'm going to stick with you, Rob, for this next question. They're asking, at 75% and above, will we be able to run outreach events that permit community members, those who are not WVU students, staff, or faculty, to come onto campus, or will they have to require that they show they are vaccinated?
So that's something we'll be working through with the summer. I'll make a couple of general comments. I think once we get to a 75% rate, I think we'll feel really good about our campus. I think to the extent that we allow routine opportunities like that will probably depend on the infection rate in the community at large and the percent of the state or the region that have been vaccinated as we move forward for that piece. One of the things that we have shied away from for a number of reasons, but I'll just indicate this is requiring proof of vaccination at the individual level. With as many buildings and as much space as we have on our campus, going through a sort of vaccine passport on our campus would be something that would be very difficult to pull off. So what we have decided to do, at least for now, is to look at the general rates of vaccination and the general rates of infection, to look at the types of activities that will be authorized and offered on campus going forward. Not to say that there wouldn't be something where we might require proof of vaccination, but that quickly can get very onerous and tough to enforce and implement across a campus like ours.
All right, great. Thank you, Rob. Marianne, this next question is for you, and they're asking, when will labs be open for undergraduates?
That's a really good question. My understanding is the labs are open, but we are following the COVID safety guidelines, which call for social distancing and mask wearing, and that will continue through the summer. And then our classroom labs will be open per usual in the fall. And the research office will be making, I think, further determinations on how the research labs will be run. And I urge everybody to go to the research.wvu.edu website for the latest details on that.
All right, great. Thank you. Rob, another question for you, and they're asking, I know that many staff and faculty have children who are not able to be vaccinated yet. If we need to care or quarantine for COVID positive family members, will policy remain similar to current guidelines?
So really good question. The special COVID-19 leave policies that were in effect this past fall or this past spring have expired. However, provisions relating to sick annual leave and the Family Medical Leave Act are absolutely still in place and will be available for use. I will say that if we have a faculty, staff, or student member who, and just as a practical matter, assuming we continue with not requiring a vaccine, if one of those individuals chooses not to vaccinate and has to quarantine, or gets COVID and has to be out of work, they will be required to go through their sick or annual leave. If it is a child who was ineligible to be vaccinated who gets sick or gets into that situation, we will continue to be flexible with that employee to work through that situation.
All right, great. Thank you, Rob. I'm going to stick with you for one more question. They're asking, will the remote hybrid work schedule continue for non-ADA employees for all campus locations or just Morgantown campus?
So it'll be a campus by campus determination as to who stays remote, who is hybrid, and who returns to campus. And those guidelines will be different because of size, scope, and scale of Morgantown versus the other campuses. It'll be a different determination that those campus presidents will largely be working to design.
All right, great. Thank you. Dr. Coben, a couple of questions for you. And the first, they're asking, do you know when the vaccine will change from EAU to FDA approved?
I do not know when that will occur. I will say that this is done on a vaccine by vaccine basis. So in other words, we currently have 3 vaccines, the Pfizer, the Moderna, and the Johnson & Johnson. In order for them to in order for each of those vaccines to move into an approved status compared with an emergency use authorization status, they have to reapply to the FDA for that approval. It's my understanding that at this point in time, the Pfizer vaccine has been submitted to the FDA for approval status. So when that determination will actually be made, I don't know. But I suspect that Moderna will be following shortly behind, and then Johnson & Johnson thereafter.
All right, great. Another question that ties back into the vaccines and boosters. So they're asking, is it true that boosters are going to be required? I've heard that the antibody is only lasting about 6 months.
We don't know yet whether or not boosters will be needed. The current evidence actually looks as though the immunity provided by our current vaccines lasts at least 8 months. And there are continuous research studies undergoing to see whether or not it may in fact last beyond 8 months. At the current time, there is no specific recommendations around boosters, either from the FDA or the CDC. So we'll just pay attention to that. And certainly if that becomes a suggested recommendation, we will do everything we can to make that available to our campus community.
All right, great. Thank you, Jeff. Corey, I have a question for you next, and it ties in with the residence halls and student rooms. And they're asking, will students have the ability to change residence hall rooms if they find out that their roommate wishes not to take the vaccine?
So thanks, Sharon. Short answer to that is yes. Students can change rooms for a variety of reasons. So we would allow students to change rooms for that reason also.
All right, great, thank you. And Rob, this question is for you and ties back into some things supervisors may need to do. They're asking, will assumptions be made regarding the work status of student workers and GRA employees? In other words, will supervisors need to update the work status for these groups just as is being required for typical regular employees?
And Sharon, I believe to date, the focus has been on regular employees. And so may need to ask Corey, or if not, we'll need to get back to you on the answer to that question. But I believe the focus to date has been on regular employees and their work status, their full-time benefit eligible employees as opposed to student workers as far as working remote, and that there will be more in-person opportunities for our students as we ramp up for the fall. But I'll need to if Corey has any additional information, I'll punt to him, but if not, we'll have to get back to you on that one.
And only other thing I would add, Rob, is as most of the things are going to be made by, in some respects, office by office, and in some respects, position job by job basis. But yeah, more to come, I think. Yes.
All right, great. Thank you both. Dr. Coben, this next question is for you, and they're asking, are there any concerns regarding HIPAA and the vaccine verification system?
I don't believe so. I will ask Rob to comment as well. I will state that the verification system is being maintained in a HIPAA compliant database within the university. So I really don't believe that there are any issues or concerns. Rob?
There are not. As you, if you're a student and hopefully are aware, we actually require that a student get a number of vaccines before they can be on our campus, and we are fully authorized to obtain that information from our students as a condition of being at the university, and asking for proof of vaccination for our employees and our students to provide that so that we can make campus decisions is something that we all are authorized to do.
All right, great. Thank you. And this next question, I'll probably start with Rob, and then we might have Corey weigh in as well. But they're asking, with so many staff members working remotely, is there any concern that the student experience will be compromised or that we may not be meeting the needs of our students? So Rob, I'll have you weigh in from the employee perspective, and then Corey from the student experience.
So first, we've actually gone unit by unit, employee by employee in making that determination. I'll also say that to date, this has largely been a non-academic exercise going forward. You know, the faculty for a long time at the university, they know when they need to be on campus, when they can work in other situations and handle that just fine. And so we're going through an analysis of what employees could work from home that would not impact the student experience. And so, for example, we have a number of folks from an ITS perspective, or from a financial perspective, or from a human resources perspective, who are not really interacting student face-to-face individuals who can work from home. But if there is someone who does have a student facing forward experience, they will be back on campus. And so while we will be keeping a number of individuals in hybrid or remote, there'll be a lot of folks who are coming back for the fall. And that's actually one of our determining factors is, do they need to be here on campus to meet one of our student research or service missions, or can they do that function from a remote site?
Yeah, and Sharon, I mean, I'll add, look, we heard our students, we know they didn't have the experience they wanted this year. And so our goal is to get back to that collegiate experience that we all have imagined and experienced or want to experience. And so our goal, first of all, is to preserve and protect that classroom experience, because the goal is to get students through here with good knowledge, good learning, a good learning environment, tutoring, so they can leave WVU with a great degree and have a great career. But with that, we also know that there's a lot of experiences that students need to have outside the classroom. And those are also very important to us. And our goal is to make sure we've got appropriate staffing and programs at the right place at the right time. Will it be exactly the way it was in 2019? Absolutely not. But with all of our students back on campus, we're looking forward to some exciting things, and we're going to be supporting our students every way possible.
And Sharon, I would add on the academic side that we will be working with our individual academic units to ensure that our students get the one-on-one experience that they need and want. And so I anticipate that much of that will be in person. I also think we may have some more remote opportunities that students want, right? So we've heard that students, some of them would like to do more online advising. So we're going to work through those things over the summer.
All right, great. Thank you all. Rob, this next question is for you, and they're asking, why is the university treating WVU students, staff, and faculty as the relevant group to determine the level of community spread? We live, learn, and work in the larger Mon County area community or similar around Kaiser and Beckley. Wouldn't the rates of vaccination in those larger communities be the relevant metrics to determine if a community spread remains a threat?
Well, so I guess first, from a big picture perspective, as we move towards the fall, and actually the decisions we've made today to bring everybody back have been based on the fact that not only have the level of spread within the university community declined, but we've seen a decline across the region and across the state moving forward. Now they've plateaued. We really need to see them go down further before we can get comfortable. So the first thing I would say is, in making some of the decisions to get us here today, and as we look towards the fall, we definitely will be looking at more than the vaccination and infection rates of folks on our campus. The second thing I would say is, last year in particular, as WVU went, we saw the rates of infection increase here first because our students tend to be more mobile and we are more in a more situation where there's more density, more close contact than our surrounding community. And so from my perspective, for the citizens of Mon County, and this goes from everything through K through 12 education, from high school athletics, from everything else, if we take the steps that we need to do to keep the rates of infection low and the vaccination rates high, we're going to give our community a great chance to work through this pandemic. And so when we look at what we are in control of and what we're comfortable doing on our campus, we thought it was appropriate to really focus in on and look at the accountability that we each have to each other in our community to try to drive those vaccination rates up.
All right, great. Thank you, Rob. I'm going to stay with you for this next question. They're asking, why are athletics currently permitted to have the general public in their venues, specifically the indoor facilities such as the Coliseum and other programs on campus are not allowed to have that too? Curious as to why the capacity restrictions are not applied to athletics.
So first, as I indicated, we're hoping and planning towards having lots of fans in our arenas this fall. But to say that we'll be at 100% capacity for football or basketball is a goal and a plan. But, you know, as they've gone through from a season ticket perspective, they've indicated that seating and other things may change based on on-field conditions. And so while we're planning for that, it's still going to be dependent over the summer on how things progress from a pandemic perspective. The other thing I will say is our level, while we did not put out any thresholds today, we have been discussing, and over the summer, it is possible, depending upon the rates of infection and how this progresses, that there will be limitations on the number of students that will be able to attend athletic competitions based on those levels. We wanted to get a little bit more information and look at the arc of this pandemic over the summer as we move towards the fall to go as to what those thresholds might be. But it is a level of concern, particularly for our students in those student sections, as to the rates of infection, levels of vaccine before they would be able to congregate in that many people at that one point in time. So it's a little bit of a to be determined on athletic capacity, particularly for our students as we move towards the fall.
All right, great. Thank you, Rob. This next question I'm going to ask both Marianne and Corey to address, and we'll start with Marianne. And the question is, with the current high school seniors not having a normal learning environment for the past year plus, is there any plan in place to ease the transition to a more traditional college experience? Freshman year is a huge transition during normal times, so will there be, and it will be more challenging for them in the fall. Is this being addressed?
Very good question. And I think it's on the minds of our faculty and our academic support staff, because we know that some students may have been challenged by the intermittent online and in-person experience they had in public schools. We are starting a pilot this summer, and it is what it will do is offer a small number of, I guess we call them intro classes, for students to take online in a concentrated time period right before the start of the semester. And we're really targeting this right now to students who are struggling, and particularly in certain counties in the state. And if this works, we will duplicate it and expand it for next year, but we will certainly be on alert to help students as they transition academically to the start of the school year.
All right, great. Thank you, Marianne. And Corey, do you want to maybe address how we'll help students transition to college life from a student life perspective?
Yeah, absolutely. So thank you. It's a great question. We know it's been different, and it'll still be a little bit different year, but certainly a lot more normal than what we're used to. And so we'll be adjusting and have adjusted our programs. We've got a number of programs, even outside of a pandemic, that we have available to students to help with that transition, from some specialized programs like the STARS program or student support services. Adventure West Virginia is one of those transitional programs that we know hundreds of students have signed up for this summer. We'll have some programs embedded in Welcome Week that will help with that transition. Every first year student signs up for the WVU E191 course, which is, again, part of that transition and support to teach students about the resources that are available to students. And then those students that are living in the residence halls, there are RAs, 1 or 2 on every single floor, to help you with that transition. So we'll have lots of resources available. The key to that, though, is for our students to take advantage of those resources and to ask for help when they need that help. We'll work hard because we know it's going to be a different transition, but the resources are there, and we're excited to have our students take advantage of them every single day.
All right, and Corey, I'm going to stick with you for this next question as well. They're asking, are we able to provide mental health check-ins for students? COVID has obviously taken a toll on everyone's mental health, and adjusting each other and ourselves back into a social environment could be hard for a lot of people.
Yeah, it's a great question. Now, look, we've heard our students this year. It's been a difficult year, and our career counselors will continue to be available. We'll have in person. We still have our crisis text line. We will have our RAs and commuters. We're doing some specialized training, and as I mentioned just a minute ago, we will embed a number of resources and mental health check-ins. I mean, and Sharon, I'll say, if the question is, will our career counselors be able to call all 27,000 students? That's not likely to happen realistically, but our counselors there to support our students. Same thing with RAs who've received some training, and absolutely, and our new Healthy Minds University group, they will be there to support our students and through the transition back, because it will be tough. We know that.
All right, great. Thank you, Corey. Marianne, this question is for you and talks about advising, online advising, and the viewer writes, online advising was inadequate this year. Will the fall semester have designated in-person advising hours?
Yes, so I want to answer that and say that I'm sorry that whoever wrote that may have not had an ideal experience with online advising, and that may be the case. I know there are other students who really liked it. But that said, we will have in-person advising, and we may implement some online advising if students want it.
All right, great. Thank you, Marianne. Let's see this last question. Let's just toss this one over to Rob first, and others may jump in. But they're writing, will students who are vaccinated be given preferential treatment over those who haven't been vaccinated? There are many reasons why someone would choose not to be vaccinated, and I worry that they will be punished for that. So we'll start with Rob, and Corey might have you jump in there a little bit.
Well, so we're not going to, right now, we do not have a requirement. Let me repeat that. I think as Jeff indicated, once these vaccines move from an EUA to a full status, we will reevaluate that. I don't look at what we're doing through this pandemic for anyone as a punishment for anything. What we're trying to do is to keep our campus safe. And so if you vaccinate, which we believe that is the absolute right thing to do, they are safe and effective, and we believe you're protected, and we don't need to worry about calling you to get contact traced or to be tested or to have quarantines from travel. That's not a punishment. It's a reality that this vaccine is going to pull us out of this pandemic, and it provides invaluable, immeasurable protection against a very dangerous virus that is spreading and the variants are spreading on. And so this is a way of saying, if you get vaccinated, we think it's safe enough to where we don't have to bother you with those things. We don't see it as a punishment. We're in a race. The more we get vaccinated, the less chance we have a variant that gets around the vaccine and the quicker we can get back to normal. Everything we're doing is designed around keeping our community safe. As of right now, if you choose not to be vaccinated, we understand that that's a choice, but also know that we're going to do what we can with what we think is the best way to move forward to keep our campus safe. And if you choose not to take that vaccine, then there may be things you have to do in terms of regular testing and other things, because we don't think it's safe if you're not given those level of protections for that choice. The final thing I would say is, if you think that there are a number of reasons not to take the vaccine, I encourage you to talk to a healthcare provider and get the real facts about these vaccinations. I'm not saying that there are not any risks or that there couldn't be situations that you wouldn't be there. But in listening to our healthcare experts, and Dr. Coben and his team are just fabulous, and Carmen Braille and everyone from Student Health, we can provide you the facts about the efficacy and the safety level of these vaccines so that you have a true picture and can make that informed decision yourself.
I couldn't have said it better. Great.
All right.
Thank you. Yeah.
All right, Dr. Coben, anything you'd like to add to that question?
No, I think Rob really stated it very well. The greatest benefit will be to each individual and their family who gets vaccinated in terms of the protections that they receive, but also realize that for individuals who are not vaccinated, we do still have to follow protocols. And that means that, they may be required to quarantine for up to a 2-week period of time if they're in contact with someone that has COVID-19. And that can be very disruptive to their learning and to their education and to their progression through our program. So for all of those reasons, I would really just encourage people to go ahead and get vaccinated and get protected.
All right, great. Thank you, Dr. Coben. And I think that's actually a great question to end today's conversation. We're coming up at that 11:30 hour. So as we close today's conversation, I just want to remind everyone that we will continue to provide up-to-date information on these plans, as well as new information as we move through the summer months. Therefore, it is critical that you stay current with the information we are providing. Please check your university email accounts daily for any new information. Review e-news every day for the latest updates. That is your go-to source for university news. For our students, please check your UNews for the latest information. And for our parents, you'll want to check your inbox for the Mountaineer Parents Club newsletter. Remember, you can also find everything you need to know about campus life during the pandemic on the Return to Campus website. It is updated immediately when new information becomes available. I also encourage you to follow us on social media, and in particular, the Safety Social accounts on Twitter and Facebook. An archived version of this conversation will be available later this afternoon on the Return to Campus website. And you can also continue to send us questions to returntocampus@mail.wvu.edu, and we'll get back to you with an answer as quickly as possible. As I've shared, there are a variety of ways to get the information you need. Please do your part to be an informed team member and share accurate information with others. We see a lot of misinformation being shared, particularly on social media. So if you are unsure about something, please send us an email to get the correct information. And finally, I want to thank our panelists who have shared their time and expertise with us this morning. And on behalf of our senior leaders, we appreciate you sharing your time with us today as well. Please continue to stay safe and be well.